Hello! We are going to be feeding puppies today, or we're going to help Mommy do it. Hi, my name is Haley and I am owner of Arrowhead Bulldogs, and we have some 3-day-old puppies, and I wanted to show you guys how you nurse your English Bulldog puppies. So, well, she's pottying her while I'm speaking. So when you bring your puppies home, they won't be quite this big. In 3 days, they've already grown like you wouldn't believe. So typically what we do is first thing when we get home from the C-section, we lay Mommy down because she doesn't feel good. So we'll help her lay down and then we'll attach puppies or lean them up against her. So like right now, these guys have really gotten good at smelling the nipple and helping themselves to a little snack. But when they are first born, it's a little bit more time consuming, and it's actually the most stressful part for me because I need them to hurry up and eat because I don't want their sugar dropping. I want to make sure they get that energy and that colostrum. That's really going to protect them for the first few weeks of life. So a lot of the times when we first bring them home, we help Mommy lay down. This isn't her favorite side. Oh, there she goes. This isn't her favorite side. It doesn't hurt her. I'm not pushing and pulling. I'm just trying to help get her in a comfortable position. I'm not yanking. I'm not doing anything that might hurt her. I mean, obviously she's not fighting against anything here. So a lot of times when you bring them home first, they don't really, they know how to suck and they know how to help like paw at the nipple to help get the milk out, but they're usually pretty tired from the medicine that the mother had during her C-section. So a lot of times you'll have to kind of open their mouth just a little bit, take the nipple and kind of push it into their mouth. And quite honestly, the first 24 hours, I generally will sit here and hold them to make sure that they stay latched properly. But as you can see, these guys are pretty good at it. Just within such a short amount of time, we just make sure that they come on, they come in, and then I do help them. Sometimes they'll attach to like a foot or a paw or something, or even their siblings. They'll start attaching and sucking onto them instead of the nipple itself. So we don't ever leave them alone. I'm always here with them while they're nursing, making sure that they are getting good suction. Sometimes you'll hear them go like a clicking sound, and that means that they don't have a good suction. It's like a as they're sucking. So when that happens, one of the things that you can do is you just gently pull this skin up and close the corners of their mouth, because that's usually where the air is coming in. You just kind of tip it up or put your fingers right at the corners. See how, I don't know if you can see that, but they make this really great little suction right here with their tongue right around the nipple. But sometimes if they have a hard time latching, then you just put your fingers right beside their mouth, and it helps close off that area so that they can get a better latch. If they don't have a proper latch, it can really affect their nutrition, their weight gain obviously, and it's not draining the mother's boob as it needs to be. So you don't want that milk to become too engorged and run the risk of mastitis. Right now we have them inside our whelping box. You can use a number of things. When we first started out, we just had a blanket on the floor, and it was a hardwood floor. And that actually was really difficult because as they're nursing, they tend to push, whether against me or against the flooring, and they would end up sliding away from me. So that got really frustrating and tiring. You can also use, I've used pack and plays with the side cut out. Hi, Mama. You can also use baby swimming pools as a whelping area. There's lots of options that you can do. But you always want to make sure that the bedding that they're going to be getting on is clean, which can be kind of costly right now because of all the fluids that Mommy is expelling. Where are you going? You just want to make sure that it's clean. So we go through quite a few puppy pads right now. I'm just making sure that she's clean and that the puppies are clean. So like right now, she's wanting to clean them, and because she's a more experienced mommy, this isn't her first go around, I give her a little bit more freedom. But with her first litter, I didn't give her quite as much, just because she wasn't quite as sure-footed, and it also depends on your dog's personality. So like right now, I got her to lay back down. You just be gentle with them and help guide them. You love on them. This is also a really good time. Like I'll sit here and I'll wipe their creases, or I'll clean their ears, give them a little massage. I'll put some essential oils on them sometimes, just trying to make it as good of an experience as possible. She's also starting to shed, as you can see. So sometimes we'll use the brush and just make it more relaxing, although she's sleeping. So as they're nursing, especially for the first week, you want to try to make them, or not make them, but help them nurse for at least 15 minutes. So I generally set a timer, and I try to just keep encouraging them to continue to nurse that whole time. So sometimes, I don't know if you can see, but like they might not be super active nursing, so you just kind of tickle them a little bit, get them, remind them, hey, there's food, take some drinks here, please. But it's not going to be a continuous suck, right? So they'll suck a couple times, and then they'll start sucking faster at the beginning, and then their sucking will slow as the milk drops. And as their milk drops, sometimes you will have it come down so quickly that they can't swallow it as fast, and they may choke, or you may get milk bubbles coming out of their nose, which can be scary, and it can be life-threatening if you're not paying attention, which is another reason why you don't leave them alone with the babies at this young of age. So when the milk bubbles start happening, or they start coughing and sputtering, I keep a number of different type of booger suckers here with me, just like the basic ones that you have in the hospital, an automatic one, and also it's kind of another manual one, but you put this on the edge of their nose and you suck here, and there's a filter inside so you don't get any yuckies. But all of these serve a purpose. I use this one for more of like a newborn stage. The hole just goes right around their little nostril, and then I just suck as much as I can, but it's only limited to your own breath power. This one's really good for women newborn also, just because it can get a lot of the fluid and the milk and things out of their mouth or their throat. And as they get a little bit bigger, this is very helpful because it has a lot more power. So you just kind of maneuver a little bit just so that you can make sure you get the nostril, and it pulls out a lot of milk really quickly. So if you have somebody that has a lot of milk coming out where you can hear the gurgle and their breath, these are really awesome to get that out for you. So as she's nursing, I mean, she hasn't been nursing for quite as long as what I would like for her to be, but she's also not going anywhere, so she's giving the puppies an option to nurse. So as your female gets older and is more experienced, you'll be able to do that as well. But like I said, for the first 24 to 48 hours, I try to make sure that they lay down the whole time to give every puppy the ability to suck, to nurse. And I'll lay her down so you can see. They haven't been nursing that long, but her milk has come in, and they've gotten very good at making her milk come down, and their latch has been really good. So they'll drink faster. They'll be able to get fuller quicker. And you can tell when they're full because you'll see like this little, look at this belly. Look at that. That's all food. Huh? You can see their little belly. It's all full. And you don't want them to get overfilled, because if they get overfull, then you run the risk of them puking or having milk come out their nose. And when they do that, then you also run the risk of them getting aspirational pneumonia, which is life-threatening, obviously. This is another reason why we don't leave them alone. While she does potty them, it helps by me holding them. It allows me to make sure that they are going potty. Usually it's very messy for me though. And we will do this every 2 hours for the first 2 to 3 weeks, and then after that I will do this every 4 hours. As the puppies get older and I don't have to worry about them as much getting smashed or mommy sitting on them or stepping on them in any way, then the older they get, then I will be able to let them hang out with their mom a lot more. But for their safety, I'm with them all the time when they're with their mommies. I also will have Alexa remind me every 2 hours, or set a timer on my phone or whatever it may be, just so I can remember. I don't want to ever forget that it's time to eat. Sometimes I'll freak out and I'll sleep through it, and then I'll wake up and I will be completely panicked thinking that I've gone hours without feeding them, but usually it's not very long. If you also have a new mommy, sometimes she won't do this on her own, so a quick little tip is just to put some coconut oil on the puppy's bum, and then that way it'll kind of help entice her to do it on her own. Or you can also use a baby wipe. And then you just gently rub the baby's bottom. And be patient, because they'll go. You rub their bottom with a wipe. You can also use a cotton ball. You just don't want to be too rough, and you also don't want to make their bottom raw. So there you have it. It's pretty simple. It's tiring and it's time consuming, but overall, it's pretty simple. You just have to be awake, be observant, be patient. Patience is huge, especially when they start playing musical boobies. When they get older, they'll start going from one to another, which is so annoying. Just stay on your boob that I put you on. But that doesn't always happen. There. Yeah. Everybody see. So we just keep encouraging them to eat until the timer goes off, which I didn't set this time, but I have the recording on the camera to let me know how long we've been maneuvering here. Check the sides of the nipples, which side they need to nurse on, empty the ones that are the fullest, be observant, be patient, and let Mother Nature do her thing. Let us know if you have any questions, comments, and I'll be happy to answer any of them for you. Thanks for watching.